Sue. Everything okay?
Robin, we really need to do something about the cleaning crew.
Good morning, Sue.
Little Miss Peachy Keen's here.
Coffee, anyone?
Yes, please.
Yes, please.
Morning.
Morning, Dr. Walker.
Calm down, Rachel.
What's the matter with you? You're hopping around like you have to go to the bathroom. What's going on?
I wonder what the new doctor will be like.
You know what? Stop daydreaming. All we can hope for is to be the clone of our own good doctor.
And you'll be here later, Rachel.
Right, we have enough to handle with you.
Some people chopped out.
Hi, Myrtle. How are you?
Plop yourself right down there.
It does feel good.
Yeah, it sure does.
One of the major challenges in the healthcare industry today is the ability to strike a balance between business efficiency and taking the time to provide needed bedside manners. Superior healthcare stems from greater communication between staff and patient. Research shows that 93% of human communication is nonverbal, or what may be understood as body language. Considering this fact, how can any book or training material attempt to teach customer service skills to the healthcare industry without first addressing the body language cues that commonly occur, or more importantly, should occur, between staff and patient? A compelling question indeed. Knowing the most common body language cues can help you understand what a patient may be thinking, but not necessarily saying. More importantly, learning body language cues can help diagnose patients more accurately. Body cues can also help you express yourself in ways that convey likable qualities to both patients and coworkers. Contained in this video are key body language cues that communicate proper bedside manner while still maintaining business efficiency. Keep in mind that receptionists and nurses also act as customer service representatives. These professionals, on average, spend more time with the patient than the practitioner. This means that the body cues of the receptionist and the nurse are just as important as that of the physician. We'll discuss decoding. Decoding allows you to understand, or decode as it were, a patient's body language cues. Decoding can help you to understand what a patient might be thinking versus what they are actually saying. Later, we'll discuss encoding. Encoding is a body language cue that you initiate. Encoding is a powerful tool in the healthcare field because it allows you to control the manner in which a patient perceives you. So what are the most important body language cues for the healthcare industry? Let's find out. Now, let's examine the aspect of decoding a patient's behavior. Decoding means to observe what the patient's body language cues mean. Take a look at this example.
Joey!
Dr. Walker, how are you?
Welcome to the office.
That
Good
would
to
be
be
in the
here.
top drawer of your desk, Doctor.
Thank you, Robin.
You're welcome.
Could you get us a lab coat for the new doctor?
Certainly.
Thanks, Robin.
You're welcome.
Well, nice to have you with us, Joey.
I really appreciate this opportunity, Dr. Walker. Thank you.
Well, somebody's got to take over when I leave. So, let's give it a shot.
Here you are, Dr.
All right.
Gordon.
Thank you, Robin.
You're welcome.
I thought I'd just observe today. Is that all right?
Aw, Joey. No time like the present.
All right.
Jump right in.
Henry, this is Dr. Gordon. He'll be taking over.
Dr. Walker, I'm not sure if this is really the...
Don't get upset. I've got to retire sooner or later, and, well, sooner is better. Dr. Gordon, this is Henry Jones.
It
nothing.
says
It's
here
not
you
a
were
big deal.
in and treated for the same type of infection a month ago. Are the symptoms
Henry,
the
I'm
same?
writing you
Have
a
things changed?
prescription
Yeah,
for
they're
a
the
stronger
same. It's not
dose
a
of the
big-
same medicine you had the last time. And if you have any new symptoms, give me a call.
Henry, I just want to know. Tell me
Henry,
more
thank you for
about
coming
what's
in.
going on.
Sue will take care of you on the way out.
All right.
It's just an infection, Joy, not brain surgery.
Dr. Walker, I really think there was more going on than just an infection.
An infection. More to an infection?
Yes.
You know, watch and learn, Joey. This is an efficient, well-run machine.
As the new doctor, Dr. Gordon, pointed out, patients may be communicating more than just words. By reading a patient's body language cues, we can see if their thoughts support what they're saying. We can also recognize when we need to probe further into their health by asking more questions, or whether their body language suggests confidence in what they are saying. First, let's examine some patient body cues you should observe. Let's start with a patient expressing doubt.
It says here you were in and treated for the same type of infection.
Notice how this man is touching his eyebrow while he speaks. This body language cue, used in conjunction with the other body cues, is a good indicator that the patient is being doubtful or deceptive with what he or she is saying. When the eyebrow touch is used in conjunction with avoiding eye contact or looking away, more questions need to be asked. Probing questions could uncover additional symptoms necessary to make the most accurate diagnosis. Anytime a patient positions his or her arms in front of their body, be aware that he or she may feel uncomfortable or even defensive. Patients can exhibit this behavior when they feel vulnerable at a clinic or hospital. It is important to always watch your patient's body language for possible inconsistencies with what they are saying. First, on our list of encoding body cues is the voice of enthusiasm. Let's turn our attention to Sue, the receptionist. Sue is a patient's worst nightmare. Remember that a patient has made an appointment because they have an issue with their health. Pretty obvious. The patient may not be feeling well, or they could be in a lot of pain. Let's again watch Sue in action. Imagine you were in pain and you had to endure this voice tone.
Let me turn you to the back. Yes. Have you read the form yet? Go back, sit down, read it, sign it, and then read it again. And then if you have any questions, you can ask Rachel, okay? All right.
Voice tone alone accounts for 38% of all communication. Sue sees the patient as a bother, and her voice tone reveals it. Notice how she justifies her behavior.
So, having a good day?
Peachy.
Can I help you with anything?
You know, as a matter of fact, you can. You can go right into the back and just stay there and stay out of my hair.
You know, Sue, you could try to be a little nicer. I mean to the patients, you know?
Nicer? You want me to be nicer? You know what, Rachel? This place has to run like a business. Do you know why? Because it is a business. And Dr. Walker depends on me to make sure that it continues to run like a well-oiled machine. I can't do that by being nicer. Nice is your job, so why don't you go on to the back, find somebody to be nice to, and leave me be. Let me be efficient and get things done.
Every healthcare facility must run efficiently, but Sue has overlooked an important aspect. Other than setting the appointment, the receptionist is one of the first points of contact between the healthcare provider and the patient. Fully appreciating that the goal is to put those that you care for on the road to better health, that road begins with the receptionist. Every receptionist must realize that a more comforting and encouraging voice tone actually is an integral part of the healing process. On the other hand, let's examine an example of proper voice tone. Notice how Dr. Gordon uses a positive voice tone and how the patient responds.
How are you doing today, Miss Stevenson?
I'm doing well. My husband just got a promotion.
Really? That's terrific. What's going on?
Well, he's been with this company for about 10 years, and this is the third promotion he's had since.
Wow. Well, you must be really proud of him.
Oh, yes.
Well, congratulations. I think that's terrific. Now let's get back to the stitch and see what's going on with that, shall we?
Okay.
By using a positive voice tone, Dr. Gordon was able to create a positive experience with the patient. And remember, a positive voice tone takes the same amount of time as a negative voice tone. Next is the open hand. Rachel used an open hand body cue. An open hand is a signal of acceptance. When speaking to a patient, use your hands to gesture with your palms facing upward. Remember, hands facing upward, accepting. Hands facing downward, dominant and controlling. Research also shows that using an open hand stimulates thinking and allows you to communicate more effectively. An open hand will also put your patient at ease and will encourage them to listen to your diagnosis and treatment recommendations. Now, let's look at the extreme opposite. This negative body language cue from Dr. Walker has been exaggerated to make a point. Take a look. By holding a pen in his hand rather than using an open hand while facing the patient, Dr. Walker is not encouraging open communication. His bedside manner is a poor example of patient care. Next on our list of encoding body cues is eye contact. Here, Dr. Gordon continues to not only position himself toward the patient, but to make solid eye contact. Eye contact immediately establishes connection between a patient and staff, allowing the patient to feel a little more at ease. Eye contact demonstrates that you are engaged in the conversation and that you understand the importance of their concerns. Eye contact communicates interest and confidence. Next is the eye zone. Understanding the eye zone can help you maintain eye contact with your patient. By using this technique, they will feel comfortable talking to you. They will appreciate your confidence and will not feel that you're being too invasive. Let's examine the eye zone. Look them directly in the eye. After you have established eye contact, focus your eyes on other parts of the eye zone. As you talk to the patient, feel free to move your eyes within the eye zone as you see in this example. But remember to rotate between eye contact and other parts of the eye zone. As an exercise, practice with a family member or friend to become more comfortable using this technique. Ask them if they feel that you maintained eye contact even though your eyes moved within the eye zone. Direct eye contact with a patient is critical, but making the patient feel comfortable is just as important. By using this technique, your patient will feel comfortable talking to you. They will appreciate your confidence and will not feel that you are staring them down. Now let's talk about the tilted head. By tilting the head while listening, you can demonstrate genuine interest. It also physically puts you in a position to better understand the conversation. The head tilt lets the patient know that you are sincere in your interest and you're listening to their challenges. Bottom line, tilting the head creates the inner focus necessary to hear what the patient is really saying and to better understand what they may be holding back. Another encoding body cue that suggests friendliness is crossing your legs toward the patient. Crossing your legs in the direction of the patient displays a body cue of interest. Why? Because we subconsciously cross our legs toward people we like. It's a subtle body cue that will communicate to the patient that you are interested in them. Conversely, Dr. Walker crosses his legs away from the patient. By doing this, he sent a message that says he is interested in everything except the individual he is there to treat. Once a patient begins to feel disconnected, he or she is less likely to openly and honestly communicate. This also encourages them to feel neglected and can lead to a negative experience. Next on our list of body cues is facing the patient. Facing the patient directly indicates that you recognize and value them. Every patient wants to be acknowledged. By initially facing them, your patient will feel a greater sense of appreciation and will likely return for additional patient care. Key body language cues, including critical information from the patient, can be missed. Remember, facing the patient says, "I acknowledge you." In the case of Dr. Walker, the patient had more to add. Dr. Walker is pointing his body away from the patient. By doing this, he is sending the message that whatever is in front of him is more important than the patient. His position displays disregard and disinterest in both the patient and what he or she has to say. Always point your body and shoulders toward the patient, not towards the door, wall, or other practitioner in the room. Finally is the genuine smile. The genuine smile reveals wrinkles around the corners of the eyes. A genuine smile communicates sincerity and likability. When used in the first few seconds of contact with the new patient, genuine smiles, along with eye contact, can immediately establish friendliness. The genuine smile can help the patient on the road to recovery. A smile involves the whole face, and a smile, when genuine, will cause wrinkles to appear around the eyes.
Hi, I'm Rachel, Dr. Walker's assistant.
The voice of enthusiasm. By using a positive voice tone, receptionists, nurses, and practitioners can demonstrate likability and a friendly attitude towards patients. The open hand. Open hands mean acceptance. By using an open hand, you're communicating that you accept, appreciate, and care about your patient. Eye contact. Eye contact communicates genuine interest and connection with the patient. And don't forget the eye zone. The tilted head. By tilting the head while listening, you can demonstrate genuine interest in the patient. Crossing your legs toward the patient. When seated with the patient, cross your legs toward them. This is a simple yet powerful body cue that communicates that you have a sincere interest in them and their well-being. Face the patient. By facing your body towards the patient, you convey genuine interest. Finally, smile. And remember, make this a genuine smile that involves the entire face and creates wrinkles at the corners of the eyes. Taking the steps to improve communication with patients requires time and attention. This brings us to Dr. Gordon and the challenge facing healthcare today.
Everything okay? You've been here a while, right?
5 years.
Have you ever noticed how
Now,
Dr. Walker
Dr. Walker can have a patient in and out in 5 minutes, completely ignore them, and still manage to make a diagnosis?
And you stay.
Yes. He's a great doctor. And to be honest, a lot of their patients really appreciate his timely manner.
Yeah, but
And you are here how?
my parents know Dr. Walker.
Oh. Maybe you could help him with his bedside manners.
We can try, but I mean, he was the same way 25 years ago as he is today. I don't see how we can make that happen. It's like, he's like these glasses. He is functional, cold, totally devoid of empathy.
Okay, I'll admit he is a little cool, but there is a lot to be said about his efficient
At
time
what
management.
cost? Ignoring his patients? Listening to your patients is a huge part of the job.
I know.
And studies show that patients that like their doctors are less likely to sue them. So it actually makes good business sense.
Dr. Gordon makes a very good point. Bedside manners make good business sense. Robin, our office manager, feels that office management is equally important. Both are correct. So how can healthcare providers balance patient care and office management? Let's explore that question. First, one must at all times avoid the attitude expressed by Sue, the receptionist.
There you are. Are we done yet?
Not quite. One more.
You know, if the doctor didn't insist on spending so much time with each patient in the room, talking and being involved, we could have been out of here by now.
It's not time to close yet anyway.
You'd think he'd know by now that the more time you spend in the room with them, the more time they're here, which means the more time they're here. Really, it's one simple movement. You get them in the door, in the room, out the door. It's simple, in and out. I really don't have a whole lot of hope for him.
He likes to talk to the patients, Sue. You know, get to know them a little better.
you know, that's really his own problem. I think with a little duct tape, we can make things run a whole lot smoother.
Having a good day, are you?
I'm having a great day, thanks.
A healthcare facility is a business. However, while dealing with increasing patient loads, many healthcare providers and their staff become rushed. They develop into good time managers and forget to provide a healing environment for those who visit their facility. On the other hand, a positive bedside manner plays a major role in the healing process, as well as building loyalty from those you treat. Experience shows that doctors who display a positive bedside manner build their practices faster and maintain their patients longer. Observing the correct body cues, therefore, must become a necessary discipline. A discipline that aids in the correct diagnosis, creates an environment that fosters the healing process, and, perhaps most importantly, becomes a critical ingredient in building and maintaining a successful practice. Also, keep in mind that people who have a strong personal interest in their healthcare providers are far less likely to pursue malpractice. The body language cues covered in this program are simple and easy to use. With a small amount of effort, you can grow to be familiar with each gesture. Apply each body cue in conversations with friends and family and see how effective you can become. When you receive the correct response 4 out of 5 times, move on to the next body cue. After a while, you'll find yourself using a number of body cues simultaneously. Share this information with members of your staff and build a practice where everyone successfully displays the type of behavior that creates the finest healthcare possible. In our next episode, we'll discuss more encoding and decoding body language cues to achieve greater patient care. Thanks so much for joining us. We'll see you next time.
If you want someone to care for you, you got it, you got it. And if you want someone to listen to you, you got it all, 'cause I am here for you. I am here for you. And if you want someone to respect you,